Welcome back from lunch, and thank you all so much for joining us. We have an amazing topic. Actually, we've been talking about how to even approach it because this room is full of amazing talent, and we're here today as sort of students of all of you and students of people. So, very much looking forward to an enlightened and fun discussion. I'm Simi, and really excited to be here with Michael and Matt. You know, one of the things that's fascinating is that, and maybe this is because I'm the daughter of a history teacher, but I was thinking about, as we were thinking about this session, we were talking about the multiple industrial revolutions, right? The 1780s and the 1870s and the 1960s with computing. Remember the time when the president, I think the CEO of IBM at the time, said that the world's entire computing requirements could be handled by 5 supercomputers. And of course, our iPhones today are more powerful. It was a statement of time that sort of made sense, but obviously we're now in the middle of in some senses, the 4th industrial revolution, the intersection of biology and computing. But we thought we'd perhaps start with a sense of the labor pool, right? Because every one of you has mentioned in conversations that I've had with throughout this session how talent is at the foremost, at top of any list in our agendas in so many ways. As of this morning, the world had 7.895 billion people in it, adding 1.5 or so per second, give or take, although the population growth is slowing down. There's 338 million of us Americans in the United States. It's interesting to think that there have been so many conversations post-pandemic that are like, where did the people go, right? My favorite Starbucks is closed. My favorite restaurant can't open. We don't have people to clean the hospitals. What's going on? So we took a look at, Brookings and Lancet and the National Labor Department and so many of the statistics. The workforce is about 3.5 million people smaller than it was pre-pandemic. And of course, some of it is the losses of people, right? Humans. We lost about close to 800,000 people above the age of 65. We lost hundreds of thousands below the age. But it's interesting to look at labor force participation. So at a glance, we have what history would call sluggish labor force participation, about 62%. It was 67% in the year 2000 when it was at a high. Interestingly, the last time labor force participation was 62% was in the late 70s. Remember? Inflation, high interest rates, followed by stagflation and growth. But within that are contained many surprises. So 50% of the women in the workforce had children under the age of 18 before the pandemic. They're back in the workforce at numbers exceeding pre-pandemic, so 0.4% higher. 16 to 24s, lower participation in the workforce, interestingly, because way more higher participation in education. Men without college degrees under the age of 55, back at levels exceeding pre-pandemic. The sharpest drop-off has really been actually in immigration and in the fact that over 55s have dropped off significantly for various reasons, long COVID and all kinds of things. I say all of this to say there's a lot of talk about humans and technology, and in the context of this, this world of biology and computing and the 4th industrial age. And luckily, we have a neurosurgeon among us who lives at the intersection of that. Michael, what are your thoughts about the state of sort of, what's it like? I mean, 1 out of 5 babies is born in an HCA hospital. You're one of the biggest employers in healthcare. What's it like being in the middle of this maelstrom?
Well, it really has focused the organization in a remarkable way. I think pre-pandemic, we had all kinds of different agendas we were focused on across the entire organization. And now we find ourselves in a situation where the world has gotten a lot simpler. It's really all about having the people to take care of the patients. And that's really the bottleneck, and it's really the opportunity. And, as everyone in the room knows, this was not a problem that the pandemic created. It was a problem that had been,
right,
burning for, decades before that. The divide between the demand for healthcare and the labor that we had to manage patients was just getting bigger and bigger. And then the pandemic was that last straw that really pushed us over the edge. But I love the way you frame up this fourth industrial revolution as now the combination of biology and technology coming together. And all you have to do is look at the generation that my kids are in and realize that that combination is here, and it's here to stay. And it's not the future-facing, brain implants that might catch the news. It's that they are just immersed with and connected to technology all the time. But our hospitals don't run that way yet. And that's another thing we really learned in the pandemic, is that our hospitals really look like sometimes the 1980s or 1990s when it comes to technology, where they're working with it and around it and they use it, but it hasn't transformed and revolutionized the way we care for patients yet at this point. So it's a massive problem that the entire industry is facing, but to us we see huge opportunity. If we can figure out how to harness that transformation that can occur, if we can connect technology and biology in our hospitals, we can not only close that gap, but we can probably accelerate right past it.
Oh, that's fantastic. Matt, what's so interesting, we've talked a lot about being in uncertain times, right? I mean, the Fed raised interest rates again yesterday. You think about our competitiveness in the world as an export nation, and the fact is that the dollar is so strong and has risen 30-40% compared to big export nations like Japan and Korea and China. So many implications of all of that. One of the things that was wonderful about discovering you both in our pre-sessions and you as a serial entrepreneur is a statement that stood out to me, that you said that you think that the value we create has to transcend any given investor, right? Mm-hmm. And we know that entrepreneurs more than anything create employment coming out of every downturn, and in fact employ so many of our youth today. What does this look like to you from your standpoint as a CEO of managing so many people?
I'm glad you're not asking me to comment on the macroeconomy, because I'm not an economist. But I will say this is an exciting time. And when you think about industrial revolutions, I believe that we're on the front end of a new way, an augmented way to think about people. Think about people who work for our organizations, and think about the whole person. I'm not sure that is totally new, but we've learned a number of remarkable things in the last couple of years, and technology is enabling us to engage in remarkable ways. And I think we're on the front end of figuring out, how does a person come to work and engage in a work experience? See, I'll even correct myself. They don't necessarily come to work.
Right.
But they engage in a work experience, and how does that be meaningful and then become part of their life? And I'm not sure I'm an entrepreneur. I think there's entrepreneurship can be defined in a few different ways, but I think most of my experience has come in more scaled settings, and trying to engage people and bring about the best, help people become the very best version of themselves in the settings that I've been in. Because a truism that I've realized is that if you can help people become the best as part of your organization and align with a purpose that your organization has, that far transcends perhaps the investment hold period of any particular investor.
Right.
And it actually allows you to achieve your purpose. And so we're working at Waystar to try to unlock the power of our team, and it's really inspiring to see several examples of our own team members and others in the industry.
That's
as we work
so
to
well
improve
said.
healthcare. Yeah.
So well said, right? And scaling, which is huge considering we have, $5 trillion industry, right?
Yes.
Which, what you bring up is, when you said, they no longer come to work, the question is that they do work. It sort of raises this really interesting topic that we've all talked about, which is, what is the future of work, right? Because the meaning of work and the purpose of work are changing for every generation. And it is different by generation, but then there's a lot of overlap, right? Our generation was sort of raised at a time when so many of us, the model that everyone used to talk about in the 80s was Jack Welch. Like he would come up with a recipe, and then he would speak to the chosen 600, and the chosen 600 would proselytize it across the workplace. And yet today, this sort of stereotype of the young kid who has his head or her headphones in and doesn't want to listen to us, the reality behind that misbegotten stereotype is actually, there's a real human there who is looking for purpose and looking for connection. I mean, I find Gen Z and millennials so inspiring because they, more than anything, are true to their souls, true to purpose, wanting a connection, wanting to bring in so many ways their whole selves, as you said, to work, right? And it sort of brings home this idea, right, in performing arts and theater, that there's always this fourth wall when we're performing on stage and we're doing a play, and we know the audience is out there, but we're sort of, we'll pretend we're in our story and you'll pretend you're in the dark. But then every now and then somebody breaks the fourth wall down. And we were talking at lunch about how the pandemic took the fourth wall down everywhere. Right? People's dogs were in the Zooms and people's children showed up, and we had to talk about their parenting responsibilities, and caregivers walking the hospitals were sleeping in the hospital and bonding with each other by being in the same battle and war together in a way that the walls have disappeared and we're all in this sort of river of humanity together, which in a way, strangely, for a time when we were supposedly not together so much in person, we kind of found each other in unfiltered ways, which is fascinating. I was wondering what the whole person at work means in both your contexts, you in a private sector setting, you in a delivery setting, either of you, if you want to take that.
Sure. I think that we're still figuring it out in the healthcare setting. Obviously, a lot of our business can't go home, right? I mean, a lot of it is in-person delivery of care, and we need caregivers at the bedside, hands-on. The pandemic redefined work, and we didn't really have a lot of say in it. Everyone was just sent home, and we kind of figured it out in Zoom and all of that. And now that we're back and we have options, I think we've got to spend time kind of studying the caregiving environment and figuring out what is it that the people who live and work in that environment want out of this new version. I don't know that we can just assume that it's, well, they want to have virtual options, or they want to have different technology that they can use. And that's one thing that we spend a lot of time doing, is really understanding them and their preferences and how they would like to see this new world. Because again, back to the gap, like, we're going to have to figure out a way to close this 3 million nurse gap that we're going to have. But if we just try to throw solutions at it without really understanding the people and what it is that they want out of those solutions, I think we're going to miss, and I think we're going to chase our tails. So I don't know that I know what it looks like. I know we're trying lots of different things. We're trying virtual models. We're testing different ways that we could leverage these different technologies. But I feel like we still need to learn a lot from the caregivers themselves before we land on this is what the future is going to look like. That's
so interesting, because I can hear in that a lot of heart in addition to mind, right? In that relationship, and a lot more sort of artisanal you and me as opposed to an institutional recipe.
Yeah, I don't think we can use a one-size-fits-all recipe. I don't think it's going to work.
Exactly.
I agree with that. I think you talk about the fourth wall, and what we've learned and what's really become important is the role of authenticity in an employment experience, in my opinion. We see people who want to align with a purpose. That's important to them. And I think it's easy for us to do that in healthcare, because there's so much opportunity, there's so many amazing people, and there's so much need for us to transform and improve, and there's room enough for all of us to help drive that improvement. And we find at Waystar that if we can get people to align with a purpose, in our case, to help simplify the way healthcare payments occur, then we focus on a couple of things. One is we have a theme we talk about called Best Work Always Everywhere. And so no matter where that person plugs in to do work, whether it's virtually or they come to the office to collaborate with a team member, and we're using our offices differently, we want them to feel like they can bring their best work always, wherever they may be. And we're learning, as Michael said, we're trying to figure it out, and we're trying to study the market, and we've probably read lots of ideas that others are doing as well. And we're trying to embrace those and figure out our path. But there's one other thing, if you don't mind, I'd like to introduce.
Of course, yeah.
I don't think we can look past the power of, we've learned how to work and do a lot virtually. I think we can all agree to that.
Of course.
But there's something significant and real about the power of human-to-human connection. When you sit across from someone else or you meet someone new, there's this thing called the propinquity effect. This proximity is real, and I think it's in our DNA. And so one of the things we're trying to figure out at Waystar, and we could use your help if you have any hints, is how do you maximize working effectively anywhere and also maximize the power of the human spirit in getting the benefit from being able to look at each other over a lunch and collaborate around problem solving. And there's something special that occurs that I don't think we've necessarily harnessed yet. And I would like to know your thoughts.
No, I think you're spot on. And I think that, take that idea and magnify it times 100 when you get into a hospital with a sick patient and a care team. There is just no replacement for the nurse or the doctor at the bedside or the tech or whoever it is. Being there, hearing them, looking them in the eyes, and the empathy that you can feel. And when we study this, and we're doing this right now, when we look at how much time our nurses have to spend in the rooms with patients, it's shockingly poor, right? And this is a healthcare problem, not an HCA problem. But I mean, they're in there for 30 seconds, 60 seconds at a time. And so we've got to figure out how to get the technology out of the way. Like, we got to figure out how to make it, save them time and enable them to spend more time making those human connections.
Yes.
If we keep putting more technology solutions in between them and the patient, which is what we've done for the last 30 years, like, they're not responding positively to that. And that's why I think we have the turnover that we have. I think that's why we're seeing this exit of the nurses and other caregivers from the labor force, especially in acute care. Is that it's an environment that's taking away the thing that they are most excited about when they come to work, which is the human connection.
Yeah, and I think that's the call to action for all of us as technology or other types of vendor partners to the likes of impressive provider organizations like HCA. How can we develop and deliver technology that actually is an enabler or augments the human-to-human experience? How do you take that nurse time from 30 seconds to and quadruple it to 2 minutes or whatever, and so that's a charge. That's a call to action for us in technology.
That's such a big unlock, right? And I know that, in the morning a lot of people were joking and talking about sort of they were paid to say good things about Emids. I can tell you that I was not paid at all to say good things about Emids, but I want to say it anyway, which is thank you from the bottom of all of our hearts for bringing us together. It's a beautifully curated group. It's such a wonderful setting, and it has been amazing. So many of us have talked about how beautiful it is to be together after 2 to 3 years like this, and it's lovely to see all the ideas that are blossoming between us and all the conversations that are happening as you all go back motivated and inspired sort of back to work. And so a quick detour then from those topics, talking about inspiration and what draws you in. I'd love to ask each of you if there's a piece of advice from a mentor that you carry with you. Do you want to perhaps start, Michael?
Sure, and mine's going to sound kind of strange, but I'll qualify. So one of the first pieces of advice I ever got when I made the transition from neurosurgery to working in healthcare, and Health Trust was my the first company I worked for. I was the CMO there. Was don't let the facts get in the way of a good story. And that sounds like he was giving me advice to lie, which it was not the point. The point and the way I've always taken that and lived it is that, if we have a goal that we're working towards, and right now the facts aren't lining up, we should keep going, and we should continue to tell that story about where it is that we want to go and continue to work towards achieving that vision. There was always the corollary, which is just realize at some point you're going to have to make the facts fit the story. So that we're going to keep pushing forwards towards where it is that we want to be, and that's always stuck with me, and I've always taken that with me to all the roles I've had, where I've said I'm not going to worry about everyone who says that we can't do it, or we've tried it before and it never works, or all the barriers and everything about healthcare that makes transformation impossible, and on and on and on. We're just going to keep telling the story of where it is that we want healthcare to get, and we'll either get there or we'll die trying.
Yep. I've got two. One's really fast.
Okay.
I had a football coach that used to tell us, if you can touch the football, you can catch it. And I apply that, if you can touch it, you can catch it, is a way to reframe expectations about what's possible.
Right.
And almost to set a new level of what is possible.
Right.
And I think that applies to us in healthcare. The other one is a question, not necessarily a definitive statement, but I had a dear professor who I just cherished in college, Clayton Christensen, and he wrote a book about this, and I would encourage anybody to read it. He asks the question in the book, how will you measure your life? And when you think about life purpose and you think about impact, I've found that my greatest joy, I've asked myself that several times along my own life journey, and I found that my greatest joy comes when I get the chance to, perhaps in a very small way, but to help catalyze in someone else the process of them becoming the very best version of themselves. So those are two thoughts that I would share.
That's terrific. Those are really, really good examples. I think actually, speaking of impact, right? You've talked with such heart about purpose and how people want to come to work, and you talked about why the nurses are leaving the workforce, right? This idea that we've created this wall, actually, of technology or tools around us that sort of takes away from feeling the room that we're in and from actually being there. And what's so interesting is that the knock against those of us who have valiantly been trying hard to create that layer of technology in pursuit of productivity, the knock against us has been, just because you can free up 10% of the nurse's day, that's not really a tradable widget, right? So between technology and process redesign and the imagination, we can unlock pieces of our day. Those can be applied to fulfillment, right? They can be applied to a lack of burnout. But it seems like we're on the cusp of this next new big revolution in terms of applying technology in a real different way. It was so interesting. Mario Schlosser this morning, as you remember, sort of when you're talking about bumper stickers, or we're going to do bumper stickers later, that was infectious, was sort of said, he was talking about AI companies and what's happening with GitHub and just this whole next thing. Who better to ask what the future of human and machines and actual machines is than my neurosurgeon friend?
Yeah.
Michael.
Yeah, and
where are we going?
I'm equally excited about bringing artificial intelligence into the healthcare space. I think that we have to acknowledge how much that is going to require our workflows to change, and I think that's the tricky part. I tell my team and my colleagues all the time, we can't just sprinkle some AI on top of the current way we do healthcare and expect to see meaningful transformation. We've got to go in and figure out, what does the new look like? What does the new workflow look like? And what can the AI really do? But we see tremendous opportunity. I think the ability to have a system that can constantly be watching our patients and providing insights into problems before they occur, help the care team understand what's the most effective thing for me to do next in my workflow. A hospital or any healthcare setting is a massively complex, chaotic math equation. Right. And so there's no way for any individual person to be able to figure out, what is the most effective next step, what's the highest risk thing I should be taking care of right now. But you can train systems to do that. And that, again, lets the clinicians focus on just going and doing the task and filling the role that they need to fill. And so we're incredibly bullish about that. But it's going to take, there's a lot of hard work between here and now. And there's a lot of systems and platforms we'll have to set up. But I think that revolution is coming. And we've just got to kind of be dedicated to going on that journey and seeing that new world evolve.
That sounds exciting. Matt?
And I think, the perhaps overused analogy is you've got to fix the plane while it's still in flight. And so there's multiple types of innovation that can be applied. There's the incremental innovation that can lead us to successive and progressive transformation, or there's kind of the big bang, ultimate thing that's going to get us there. I think in this case, we have to drive innovation that is going to unlock administrative burden within provider organizations, especially to enable them to spend more time in communities and with patients. And that's actually going to unlock clinical efficiency, clinical efficacy and quality, and perhaps even job satisfaction for those that work in provider organizations. And one of the things we see is, if you approach innovation kind of use case by use case, and you identify use cases where there's a tremendous amount of repeated or repeatable tasks, and you can somehow automate some of those, then, for example, in the case of like a prior authorization, We all know the world of prior authorizations where provider organizations get on a phone and call for approval from a payer to perform a certain service, and they provide documentation, and that estimate is 25 to 30 minutes per prior authorization request. Think about the clinical lag that creates.
Right.
You got a patient who's there, and all of a sudden, before we perform an MRI where we could go discover something more, we've got to get prior authorization approval for you to do this. Maybe the patient leaves, and it leads to lots of manual work and assembly of information. If we can automate all or part of that, which we're doing.
Right.
We've automated 135 million in the last year. Prior authorization requests, as an example. You're taking that time from 30 minutes to seconds. You can do it pre-care. You can identify, in a lot of cases, what the right care plan or path could be. And I don't know, that may be an instance of an administrative innovation that could lead to clinical improvement and even satisfaction amongst those who are providing care. And that's what we really need to focus on.
Exactly. And the downstream impact of that is so huge, right? Yeah. One of the things we were talking about, in some senses, this incredible compression that we have in the labor force is forcing us all to really think about truly valuing the human that's in front of us differently. And we were talking about how, at the beginning, I would say 100 years ago, American companies we were building our workforce, right? That's where health insurance started, and investing in our workforce and saying, we're going to bring somebody at Ford, right? We're going to bring them in, pay them $1 a day so that they can afford to buy our cars and teach them how to build cars. It's interesting and impressive how there's a pivot back after we've been trading in humans in a very liquid labor economy to actually building talent again, right? And HCA, for example, you have your own nursing school now in so many ways. Can you talk about what you're excited about when it comes to the development of the human workforce as opposed to the recruiting piece in your own companies?
Well, I think you've summed it up well. I mean, at this point, this is the most valuable asset that we have and will continue to be for the foreseeable future. And the technology is only going to continue to accelerate that and focus it. Right. And so we feel like now, if it's strategic for your company or for your industry, you should try to, control it and own it. And so developing our own nursing workforce is a piece of that. We're the largest trainer of physicians. We have the largest graduate medical education program in the country for the exact same reasons. But it also gives us the opportunity to seize that talent at the very beginning and to begin to educate them and develop them in the new world, right? And so, we instead of having to retrain people on new ways of working, we can infuse those new ways of working from the beginning and infuse that innovative spirit and mindset, which is something that is different. I mean, one of the reasons why healthcare, I think, moves so slowly is that it's high risk. And so innovation and trying new things out. I mean, the last thing you wanted me doing when I was a neurosurgeon was coming in and being like, I'm going to try this operation a totally different way today. Let's just see what happens if I do it, with my left hand. So, that's just not the way healthcare, workers, healthcare leaders think. And so we've got to train a new group who understand how innovation can be infused into healthcare so that we can start to catch up with other industries. Right. And I don't think that we're going to innovate in an organic way the way others have. I bought a car on my phone, a few months ago when my son turned 16. We're not going to see that kind of transformation in our hospital just because it's possible. It's
fundamentally different.
It's too high risk. We're going to have to engineer it a little bit.
Yeah.
No, for sure. Matt?
Well, we talk a lot, I believe, fundamentally, that the great software businesses, that's what we are also great people businesses. Right. And so we talk as much about people as most professional sports teams do. We don't track 40 times in high jumps, but we're tracking, do they have passion for showing up, and what can we do to help give them skill on the job sometimes, and also, what when we're recruiting people, do they have track records of resiliency that if they join us, we can harness that and inspire them to help us develop great technology, and it's an ongoing effort. We love it. It's fun, and we're always interested in getting the people side, the most important side of our business right so that we can unlock innovation and deliver it to our clients.
For sure, for sure. I mean, it's kind of interesting, right? We were talking about things we've learned from our mentors in the past, and for me, the one that stays with me a lot is seeking to understand. You know, as someone who, you know, I majored in math, physics, and chemistry, like you were trained in problem solving, add that to being Asian, and you forget that actually sometimes people don't want a solution. They just want you to seek to understand. And it's been amazing for me to be a student of people and every year to seek to understand more and to realize that solutions come to those who have the wisdom to listen with 4 ears and half a mouth in that sense. So speaking of learning from the future, I've always been a firm believer that you have to have mentors and role models who are under the age of 30, and I systematically have 2 of those a year. I'd be interested in what is a wonderful piece of stirring advice or an insight you've learned from someone under the age of 30 in your life. Start.
I think fall in love with the problem. That I think, and this is the young caregivers, the young people on my team that we've hired, and I love having young people on the team because they have no filter and they have no expectations and they'll say anything, but it's very similar to what you just said. Like, the people we're trying to help, sometimes they just want us to come there and listen to all of the problems and everything that's never worked for them, and even though that might not lead to the solution that we're looking for, we've got to do that. We've got to just sit there and listen to them and understand their reality before we can get to that point where we're allowed to start talking about how we want to make it better.
Love to fall in love with the problem, Matt.
I fundamentally believe that we have a lot to learn from this rising generation of young people. And I might just pivot just a moment.
Sure.
I'm a parent to 4 kids, and our oldest 2 are living and working in Manhattan. They're working really hard in investment banking roles, and they're busy. But one of the things that I believe is differentiating to that group of young people that we talk about a lot that will enable them to be successful is this notion of learning to do hard things. We are not afraid within Team Hawkins of doing hard things. And if you could take that mentality, and then I try to live as an example of that, so my kids never say, "Hey, Dad, you're not doing something hard," you know. But I think that's really important in the days ahead. We've got to be resilient in a tough-facing market and be comfortable challenging ourselves from in the convention of things to do hard things.
For sure. It's so interesting. I mean, for me, you know, one of the people that I watch a lot and actually learn a lot from is Kim Namjoon, who is the leader of the band BTS, which is the most successful band in the world today. And there was a really cool Rolling Stones interview between Pharrell and RM that came out this past week. And Pharrell was asking him what it was like to be the recipient of all that love from hundreds of millions of fans. And he said that, you know, the humility that band demonstrates has been one of the signature reasons why they have so many fans. It's such a movement around the world to translate their lyrics and listen to them. And he said that the thing about love is that love happens not in the receiving, but the loving happens in the giving, which I thought was so extraordinarily wise from a 28-year-old, because I think that the one thing we all share is that if we can go to work every day and put nutrients out into the world, we'll probably all end up making a difference despite all the human foibles and errors that we bring to work. So with that, thank you all so much for spending time with us, and appreciate it.
Yeah,
thank you both.
Wonderful.
You too.
Well done.